According to the data published by the World Health Organization on 11th January 2025, Uganda is one of the countries that has recorded a high number of Mpox cases in Africa, 767 behind Burundi with 798 and DRC, which has over 2,000. Apart from the border districts like Kasese and Bundibujo, the disease has also been pronounced more in Nakasongola, which has a sizable number of fishermen and mobile populations. Right now, the district tally of Mpox stands at 84.
We have been struggling with Mpox for the last 5 months. Rwampanga Town Council and Rwampanga Sub-County were the areas that registered the highest number of cases, with a population that I would call key populations as the most affected. The fisher folks, the commercial sex workers comprise almost 50% of the total cases that make 84 cases that we have seen and registered over time.
Nakasongola being a remote area, contact tracing has come at a cost, and hence the district leadership has to resort to other means to mobilize the population.
Actually, the moment we get one case, these mobilization teams go on and look for suspects. Those people who are in contact, actually they have done the work very well. And above all, we normally use the radio. We normally use calasos and also public functions. We do spread the information. And this so doing, we are alerting everyone. So that the moment they see any sign that looks like that one of Mpox, the information is passed on.
Aside from the health distress, those who have tested the wrath of Mpox still suffer stigma, which has affected their livelihood.
Ekyo kya Mpox kyankosezaamu ddala nnyo kuba mukyala wange yayiga kyalaani gavumenti yamuyigiriza ng'atungaana engoye ze bakasitoma be baasalika. Netubeera nga tukyafunira ddala n'akasente yadde teri n'omuntu ajja tulaba wano ng'abantu bayitawo buyisi. N'omuntu okubuuza aba ayinza okulowooza bugenda mukwatira mu kubuuza nga n'okuweereza jambo teri abantu baatwewala twafuna ekikoligo okubeera nga tusosolebwa ate baawulira nti kati ate buli ajja wano awandiikibwa bo baatiira ddala ne bagamba kitegeeza bakuwandiika naawe bagenda kubeera nga bakukima.
We have ensured that we work with the established and the identified health workers to extend psychosocial support to those that have been identified, but also within the households where the suspects or the sick people have been identified.
With a span of over 100 kilometers, the district only has Nakasongola Health Center 4 as the principal Mpox response facility. However, in order to accommodate the Mpox isolation center, the area had to displace some clinics, including the antenatal clinic.
We displaced our antenatal clinic from this place. This place used to be our antenatal clinic as well as our eye clinic. So we displaced the 2 clinics from here to go and occupy space up in the art clinic, and then we divided this into male and female ward. But at that time the biggest challenge was you pick a mother who has kids who are breastfeeding, some are below 5 years. When you get their mother here, that means you have to get the kids here. So it was a challenge for us, and we didn't have any isolation unit for the children.
The Mpox outbreak has brought back the discussion of readiness to handle outbreaks, bringing back memories of the COVID-19 pandemic. Dr. Henry Sendikadiwa recommends that this should be part and parcel of the health structure going forward.
I think we need to move ahead of time and have these isolation units, whether there is an outbreak or no outbreak. But in terms of capacity, I think we need to train people to be on the standby all the time to handle some of these emergencies. We handled COVID together again with her. Now, you see, we are picking on the old folks that have some experience of managing these what? Outbreaks. So for me, what I would suggest, we need to have these isolation units, I think 1 per district.